Good morning, everyone. I am Dr. Manasi Gaikwad Bobre, gynecologist and laparoscopic surgeon, would like to share some important aspects of pregnancy related information and guidelines in COVID 19 infection. First and foremost, coronavirus is a microbe which spreads by respiratory droplets sent into the air when a person who has COVID 19 coughs or sneezes, or when someone touches a surface or object that has virus on it. It lasts for 3 days on plastic and metal, 24 hours on cardboard, and 3 hours on fabric. Patient is infected 3 days before the actual symptoms are seen. Now that we know how this virus spreads, we'll see some measures to prevent it. The most important step is to practice excellent hand hygiene by frequently washing hands with soap or at least 65% alcohol based sanitizer for 20 seconds, which dissolves the outer fatty layer of virus which inactivates it. Now we should know that till the time virus is on our hand, it doesn't do much harm. But if we touch our nose, ears, eyes with them, the virus gains the entry to our nose and throat and attacks our lungs. So, along with hand hygiene, not touching your face is also important. As far as possible, if you are pregnant, avoid leaving your house even after the lockdown period is over. But if that is not possible, maintain at least 6 feet distance from others. As the mortality of this infection is 10 times more than the common flu, avoiding the infection till an effective vaccine or the medication is developed is the only way we have. Instead of your palms, make it a habit of coughing and sneezing into your elbows, like this. Or if you use a disposable tissue, discard it immediately in a bin with a lid. Appoint only a single person to shop for groceries, that too only once a week. For that, effective planning of all your meals in a 7-day period is required. Also, carrying a list of all that is needed while shopping is also mandatory. Grocery which is covered in plastic, either discard the outer cover or wipe the cover with soapy water or sanitizer, or else avoid using it for 3 days at least. Unpacked fresh goods like fruits and vegetables can be washed with water, and if possible store them in airtight container, inserting the tissue paper inside to absorb all the excess moisture so that it stays fresh for 7 days minimum. Try to make cashless payments whenever possible. Now that we have seen general measures, let's see what are the special precautions you should take in pregnancy. First and foremost is you have to continue all your iron, folic acid, calcium tablets along with your tetanus vaccination as advised by your doctor. World Health Organization has recommended at least 4 important antenatal checkups which are mandatory. First one is at the beginning, before 3 months for the diagnosis of pregnancy. Second one between 4 and 6 months for an anomaly ultrasonography to rule out any malformations in the baby and also for tetanus vaccine. Third one between 7 and 8th month to assess the growth of the baby and to know any early signs of complications, and then further between 36 to 40 weeks to form a plan of your delivery. So that if you are worried that your routine prenatal visits are decreased, do not be afraid. And for minor ailments, you can always contact your doctor by video calls or with using a telephone. Now, the next question which may come into your mind is, what if I catch a fever? The first step is to call your doctor and to inform about symptoms and any history of travel or contact with a symptomatic patient. Don't panic. Remember, urine infection is also a very common cause of fever in pregnancy. If you are having cough and cold, do not simply go to your doctor. It is very important to limit the spread of the disease. If your fever is less than 100 degrees Fahrenheit, most likely you will be advised to stay at home for 7 days. If by chance you develop any complications, like if you have sore throat, body ache, diarrhea or breathlessness and you need to visit your healthcare professionals, take only one accompanying person. Please do not take kids with you. And in case of emergency, you can call 108 for ambulance assistance, or you can call government helpline number 011 239 78046. As far as possible, avoid using public transport. When you are staying at home in isolation, you can ensure the well-being of your baby by keeping a track of fetal movements inside the womb, which should be approximately 10 in the period of 2 hours. Next thing to remember is that No evidence has suggested that being pregnant increases a woman's risk of getting COVID 19 or her chances of being severely ill with the infection. Though we have to admit that it is a novel virus, little is known about its impact on pregnancy yet. But you should know that your lungs and hearts are working harder than before in pregnancy, so precaution is always helpful. Along with this, it should be noted that risk of passing the infection to fetus, though not totally absent, is very low and no evidence of any fetal malformation or miscarriages has been noted so far. Neither the virus has been isolated from amniotic fluid, placenta, or fetal blood. But yes, the risk of preterm labor cannot be ruled out at this stage. Now, even if you test positive for coronavirus, still you can continue breastfeeding, but with stringent hand hygiene and covering your face with a mask around the baby. The safest option is to express the breast milk using a pump and sterilizing it after each use. And it is a good news that virus has not yet been found in the breast milk. Coming to the end, I really hope that I have answered most of your questions. And my dear friends, lockdown doesn't mean that you should be worried all the time, but instead use this time to cultivate healthy habits like doing meditation, pranayam, gentle exercises to keep your spirits high for the little bundle of joy which is arriving very shortly. Thank you.